Hello and welcome to another episode of PodcastDX, the show that brings you interviews with people just like you, whose lives were forever changed by a medical diagnosis. I'm Lita.
I'm Ron.
And I'm still here.
She's Jean Marie. Collectively, We're the hosts of PodcastDX. On today's show, we are going to speak about organ donation. It's a topic that's very important to us, all of us here at PodcastDX, since it was an organ donation that started our journey.
That's correct. Let me take you back in time.
Back in time.
It was 3.5 years ago when our cousin Gina needed a liver transplant, and we were already at Duke Medical Center in North Carolina for a wellness program in integrative health. Our neighbors there in North Carolina, in the rental house next door to ours in Durham, had just arrived for treatment at Duke, but they were there, instead of to participate in the integrative health program, they were there from Boston for a liver transplant. And this really piqued our interest because our cousin Gina back here in Chicago was on her last weeks of life and desperate for a transplant, and had been on the she had been on the UNOS transplant list. I was going to say Uno.
Yeah.
She only had one card left, transplant list for about a year, and was critically ill.
Right. And after talking to them for a while, we found out that Duke was a premier transplant center, and they did more transplants than anywhere else in the country at that time. And that was why they moved from Boston down to North Carolina. When we heard about this, we immediately called home and talked to Gina and got the ball rolling to bring her to North Carolina as well, to see if they could get a liver for her.
Yeah, actually, I remember that. And you guys were successful in getting Gina accepted into Duke's transplant program. But she had to take classes at the hospital, right, in order to help her recovery after the surgery?
Yes, it's a rather complicated process. I don't remember any of it, but I have the script here, so I'll follow it. It's a very complicated process. There was a class that lasted a week, and you met, I do remember you met with each department head or whatever, and they taught you how to have a successful recovery, including how to get ready for the surgery. The class typically is not for people that are dying, that are like on their last weeks of life. It's for people that just got on the transplant program. So typically patients that go there, they can handle the class and they can understand the class. But Gina was in such bad shape that I had to sit through the classes with her and take copious notes and then help her out. To get through this major surgery and life-changing operation, I think Duke puts together a pretty good package.
Yeah. And Gina was actually so sick at the time that she could hardly, like my mom was saying, attend the classes. But Lita did attend the classes as her caregiver, and I stayed at the rental house taking care of her when she was at home. And I was, in my former life, I was a medic in the Army, and I felt comfortable being able just to keep an eye on her vitals and call 911 if needed.
Yes. I mean, really, you make it sound like it's no big deal, but I think having medical background was really important at that point.
Absolutely.
And we did have like a full setup there at the house, like pulse oximeter.
Oh yeah, she bought all the equipment.
Blood pressure machine, and we had to monitor her blood glucose. I mean, it was very complex.
Right. After that week of training was over and Gina had gone through all of the medical offices to prepare for the transplant, we had to keep her as healthy as possible. Like I said, she was in really, really, really bad shape at that point. She was in and out of the hospital, in and out of ICU. Mm-hmm. And they recommended walking. And it was really hard because Gina also has, what kind of arthritis?
She has osteoarthritis, so her hips, her knees, and everything.
Yeah, she needs all of her joints replaced, so any steps at all are painful. Mm-hmm. Plus she was weak.
And she had ascites, so she had a great quantity of fluid build up in her stomach, which they would go in and actually remove
12 liters
of that fluid
every 3 days.
Wow.
Yeah. No, every 3 days. Yeah. So they recommended walking, and we tried to walk with her twice a day, but she was so sick it was really hard. But they were able to get her transplanted in about 2 weeks.
Yeah, so let's talk about transplants. All of our facts for this episode are taken from the Cleveland Clinic or UNOS, the United Network for Organ Sharing. And their websites is our resource for this. And we will put the links for both of those websites on our episode page.
Okay.
Gotcha. Organ donation is actually the process of surgically removing an organ or a tissue from one person, called the organ donor, and placing it into another person, which would be called the recipient. Transplantation is necessary because the recipient's organ has failed or has been damaged by disease or injury. Organ transplantation is one of the great advances in modern medicine today. Unfortunately, the need for organ donors is much greater than the number of people who actually donate. Every day in the United States, 21 people die waiting for an organ, and more than 120,048 men, women, and children await life-saving organ transplants. And that came from unos.org, November 1st, 2016.
Right. That number obviously varies constantly, but it's an average of 21 people a day that die waiting for an organ. And out of those 21, I'm going to throw in off script here, out of those 21, there's approximately 15 every day that die waiting for a kidney transplant. Why is this bothersome? Because you have 2 kidneys. You can donate one.
Not everyone can donate them, but a number of people could. And also your liver. Most liver donations is only a segment of the liver, not the whole liver.
Right.
But
kidney is the biggest one that they're dying from,
Yeah.
waiting for it. And it's such a simple thing.
It's
I
not-
think it's simple.
Okay.
If I can do it, anybody can do it.
Okay.
All right.
Just don't do it at home.
No, it's not recommended at home.
That wasn't in the script.
No.
Okay.
The United Network for Organ Sharing provides a vital link in the organ transplant process. Its policies and computerized network match donated organs with transplant candidates in ways that save as many lives as possible and provide transplant recipients with the best possible chance of long-term survival. The matching criteria developed by the transplant community and approved by the Board of Directors are programmed into UNOS's computer matching system. Only medical and logistical factors are used in organ matching. Personal or social characteristics such as celebrity status, income, insurance coverage, they play no role, absolutely no role in transplant priority.
But
Oh, no, we're going to talk about the process. We'll talk about the buts later.
Okay.
Before an organ is allocated, all transplant candidates on the waiting list that are incompatible with the donor because of blood type, height, weight, and other medical factors are automatically screened from any potential matches. Then UNOS computer system determines the order that the other candidates will actually receive the offers. Also, geography plays a part. Organ transplants are most successful when preservation and transport time are short. The matching system considers the distance between between the donor and transplant hospitals, and in general, local candidates get organ offers before those listed at more distant hospitals.
I thought she was going to kick in because that's what she wanted to say, but. Go ahead, but.
Okay, so say you are a celebrity. And I mean a celebrity that gets paid well, not a celebrity that was on a reality show and needs to work on more reality shows to make money. So, but say you have a large income and you have the ability or access to private aircraft. If you can register in more than one area. If you are able to transport to that area within a 4-hour window, because as soon as they call you and tell you you have a matching, that you're a match, you need to get there right away. So if you can, that's where, having greater finances or access, for example, like we live at a private air park. So we knew that Gina, even though she lives here in Chicago, we could get her to North Carolina in a 4-hour window. And
well, that's how we were thinking initially.
We were going to, but thankfully she did move there because they called in advance and said, we really want you at the hospital because we think we're going to have a match for you. And there's a football game. And you might be delayed by traffic too long. So just come right away and wait it out.
Right.
because they wanted to make sure she was there right away. And also, certain hospitals have different protocols. I don't know if we're going to talk about that.
I don't remember.
Okay. Well, I guess I'll cover it now, and then I won't cover it later.
All right.
So, for example, Duke, some hospitals will just, they get a condition report on the organ. So before they take someone off of life support, they'll say, this individual, the cause of death was blank. So, for example, if it was drug overdose, many places that are going to be doing transplants will reject the organs out of hand. Whereas Duke will send a team there of physicians and specialists to actually go there to the location and evaluate the organs by site and do testing right there to see, is it still are the organs still viable? Then they also do things such as a hot box, which means that they keep warm blood pumping through the organs so that they have a longer transplant window. Or for a liver, they'll do a mirror procedure, so they actually slice the liver to give them two identical halves.
Okay.
And they can transplant twice as many patients because of that. So depending, there are hospitals that specialize on specific organ transplants, and also the way people migrated and, where they live in certain areas of the country, you might have a greater chance of getting an organ donation in a region where your particular blood type is of greater density. Mm-hmm. So, for example, if in the Midwest area here, A positive. So if you have an A positive blood type, it may behoove you to be registered here. And then, there's different regions of the country where you might find that specific blood type in greater prominence.
Mm-hmm. Gotcha. Another factor is proper organ size, actually. Right. The proper organ size is critical to a successful transplant, meaning that children often respond better to child-sized organs. Although pediatric candidates have their own unique scoring system, children essentially are first in line for other children's organs.
Right, because you can't put. Well, same thing with Gina. She's a very small woman, and if a 250-pound man passed away,
right,
that liver might not have fit into her.
Right.
So size does matter.
Right.
Factors in organ allocation include blood type, like Jean was saying. Mm-hmm. Other medical factors weigh into the allocation of every donated organ, but each organ type has its own individual distribution policy, which reflect factors that are unique to each organ type.
And when a transplant hospital accepts a person as a transplant candidate, so they're going to be receiving an organ, they enter the medical data, information such as the person's blood type and the urgency of the situation, the location of the transplant hospital, and then also about the candidates. All of that goes into the UNOS computerized network. And when an organ procurement organization gets consent for an organ donor, it also enters medical data, information from the donor's blood type and body size and the location of the donor hospital. And they are working, and I don't know if they've resolved this yet, but they are trying to work out the geographic issues so that won't be a consideration any longer. And then using a combination of the donor and candidate information, the computer system generates a match run, a ranking order list of the candidates to be offered each organ. And this match is unique to each donor and each organ. And the candidate who will appear highest in the ranking are those that are in the most urgent need of the transplant and or those that are most likely to have the best chance of survival if that organ is transplanted in them. And then the UNOS Organ Center helps place donated organs for transplantation. They do this 24 hours a day, 365 days a year. This is, what they do. And then I was just going to say something. Okay. Because so say there's a list and John Smith is number 1 and Jane Eyre is number 2. Well, if John Smith rejects that organ because if you're receiving an organ from somebody who has, say, CMV, a gastrointestinal issue, or that the individual, the cause of death was a drug overdose, you have the right of refusal.
Okay.
Which sounds amazing. You're on death, but it's your choice. So if the first person on the list refuses, then the second person on the list is offered up that organ.
Right. And, when you're talking about drug overdose, you might think that somebody that has a history of drug use may be having organs that are not the best quality. And that's why a lot of hospitals just, as soon as they see the facts come over, they say,
They just reject it.
They reject
Right.
it. However, there are a lot of people, especially nowadays with this fentanyl problem fentanyl problem, that are dying first hit. So
Right.
the first time they've ever taken a drug,
Right.
and they're dead. So their organs might be in absolutely fine shape, but the cardiac condition, it killed them. So their liver, their kidneys, they might be fine. So I'm really very proud to say that I would advertise for Duke any day of the week because I think they're doing it the right way. In response to inquiries regarding COVID-19, because Jean wanted to talk about this, the American Society of Transplantation's Infectious Disease Community of Practice has developed recommendations regarding organ donor testing. In other words, you don't want an organ from somebody that had COVID because then you're going to be giving that person COVID, right? This guidance reflects the current state of knowledge and involves questions pertaining to screening and testing of living and deceased donors in the COVID era. So they are testing.
Do you want to add anything to that, Jean?
Well, I mean, there are a number of things that, they do test for. I know we've talked before about rabies and how important it is to test for rabies as well, because that's something that can be transferred. And then for other things, for bovine transplants, that's a big issue because you could still have, concerns about that. And
With mad cow?
Yeah, potential issues with so yeah, there's other issues, but
we're talking about people to people.
Yeah, well, people to people, you could, I guess rabies is the big concern, and COVID, there was an issue with that because your immune system is suppressed after the fact by medication, even though that also is changing, the way that people are treated and medications, and whether or not they suppress your immune system. So that's on the, that's cutting edge. It's coming up soon, and we're going to see how that plays out.
Gotcha. Thank you. And lastly, as a transplant patient, the medicines that you take to prevent organ rejection, they weaken your ability to fight infections or your immune system. You're extra cautious. You need to be extra cautious in your daily life. You wash your hands often and stay away from crowds. This is true in times of pandemic or not. Is the vaccine safe for transplant patients? Actually, the answer is yes, the vaccine is safe. Transplant patients should receive the COVID-19 vaccine. None of the vaccines approved by the FDA contain the live coronavirus, nor do they contain a weakened or dead version of the coronavirus. The vaccines have no coronavirus to pass on to the transplant recipient. You will not be exposed to this virus in any way.
Yeah, that's great. Good to know.
Yes.
Right.
Yeah. And we hope our listeners have learned a lot, and we'll make sure that we put links on our website and the webpage for this episode for you if you happen to have any questions.
That about wraps it up, unless I can throw in something like, please be a donor.
Oh, and if you can't donate an organ, and not everyone can, you have to be in really, tip-top shape to be able to donate. But if you can donate blood, there's a great need for blood and platelet donors out there. So, yeah, if you can donate blood, please donate blood.
Thank you. If you have any questions or comments related to today's show, you can contact us at podcastdx@yahoo.com. We have a website, podcastdx.com. We're also found on Facebook, Twitter, Pinterest, and Instagram.
And if you have a moment to spare, please give us a review wherever you get your podcast. As always, please keep in mind that this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment, and always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment before undertaking your healthcare regime, and never disregard professional medical advice or delay in seeking because of something you've heard on this podcast.
Till next week.